And thanks very much for inviting me, Stephen, and colleagues. It's always a bit unnerving when I follow my boss, so I'm sorry to lose Sir Albert, but I'll press on regardless. What's interesting, I think a lot of what I'm going to say actually ties into what Sir Albert says, or what he said. And for me, a lot of people have said, well, what's public health all about? What is it? You trained a doctor, what are you doing here? Well, actually, I try and explain public health as the people aspects of regeneration, or in Sir Albert's words, that renaissance. It's actually putting the built and the people together, and it's a people bit I'm really concerned about. Let's see if I can make it to work. Yes, look at that. I was pleased to note that somebody from Vancouver's here. I could have put Vancouver here. I've got a picture of Vancouver. This is those who haven't been to the 7th floor of the library. It's a view west of the city. And what's interesting is there's quite a bit green. I think you'll agree there's green, those you can't see particularly well. There's buildings and there's a canal. And that's really quite interesting. If nothing else, if you haven't been to the 7th floor, go there. It's quite a good view of Birmingham. I promise not to mention Birmingham too much, although some of my examples are from the city. But I think it can be translated into any environment, certainly in the UK, although I noticed the thing about Amsterdam, which I won't mention now. So what I'll pick up are some direct issues, some indirect issues, also some confounding. So actually, are we really killing them, or is it just by chance that something else is happening? And actually, fundamentally, is that the right question? So direct. So I can talk about road safety. I can talk about suicides. I can talk about a number of things. Actually, most cities, Birmingham included, are relatively low compared to national averages on road deaths. One can argue because they don't go fast enough. So if you're back 20 years, you want to go faster, let's have more deaths. Not too certain that's quite right, we should be thinking. Suicides, we actually have high point suicides. People jump off tall buildings. That's why you can't get out on the 9th floor anymore of the library. But actually, we have fewer suicides in cities compared to other places. Actually, it's commoner to have suicides in more rural environments. I'll come on to indirect now. So this is probably the biggest single issue at the moment, is air pollution. Now, Sir Albert talked about our fascination with the car. Our fascination, because it really is a fascination. And whether it's 28,000 or 20,000, it's a big number. And so when you take to Birmingham, it's still a big number. And that's per year people dying. Some people have said it's actually got the same effect as cigarette smoking now. Cigarette smoking is still quite common. And especially if you walk across, you'll see different groups now smoking. But actually, it's probably air pollution is fast coming up as a real issue. We think of smog some years gone by. This is similar but different. And principally, it's smoke from the internal combustion engine, small particulates, diesel cars. If you took taxis and buses off the road, this would probably, I wouldn't say go away, but would be much smaller. But it's our fascination, and we have built that environment. So if you look at all the areas in the UK and in Europe where there's air pollution problems, it's because of the fascination with car. And we've designed that. That's us. Doesn't matter what city you take. Fascination with that thing. Dad, can I have a lift to school, please? I've got to get to a meeting, but it's only a mile down there. I could walk in 15 minutes, but I'll go by car. We actually pay more mileage the bigger your car is. How bizarre is that? obesity. Huge, pardon the pun, issue, especially child obesity. It's scandalous that 1 in 4 children aged 10 in Birmingham are clinically obese. Not podgy, that's 40%. I'm talking about obese. And if you think that's bad, the estimates in adults are more like 30%. And Sir Albert talks about £1 billion, big sum of money. You'll hear this afternoon, colleagues will take you through some of the issues around child obesity. It's more like £2.6 billion, the effect of child obesity, let alone the other effects. It's huge. And actually, we have done that. We have designed that. We have let companies fool us into high energy, but also we have designed our streets so that people don't walk. People don't cycle. They get in the car. So obesity and air pollution are the same thing. And we've done it. That's our fault. We have done that. And actually, it's really quite common in cities. So if you've got obesity maps across the country, they're worse in cities. So, big question, is it the city or what we do? Well, I'm not too certain. But why do people migrate to cities? Well, there's something about safety. There's something about housing, cheap housing. There's something about jobs and opportunity. My parents came to Birmingham from Wales purely to get a job. So I stand here now as kind of Dick Whittington. You know, there's no doubt if I stopped in Wales, I wouldn't have got to this position, you know, got to medical school, all that kind of stuff. I wouldn't have done it. But the fact is my dad came to Birmingham. Whole load of reasons to come to cities. Prague is a good example of safety, of why people went to Prague, of transport, of actually trade and opportunity. Good example. And there are loads more. I just happened to put that because it's a pretty picture and I took it, but I think it kind of got over that a bit about why cities develop. But actually, cities intensify inequality. Because people who go there are desperate. People like my dad, thrown out of work, they go there because they're desperate. And actually, this is taken from Edwin Chadwick, 1842, great social reformer. And so I haven't used any recent data. I'll go right back nearly 200 years. So if you look at down here, professional, tradesmen, labourers, you will see a difference in life expectancy depending on what you do, but also where you live. And the cities of those times, the life expectancy is poorer. And that is no different now. There will always be inequalities. It's a question how big those inequalities are. And don't forget, cities just intensify inequality of health experience, because actually that's why people go to cities. And if you're lucky, you're Dick Whittington or Adrian Phillips. If you're not, you're right down there. So a bit about Chadwick, but it's really interesting. The first Public Health Act was about trying to get people to do all those things. Those of you who had water today, people had water? Came from Wales. So it's probably my forefathers gave it to you. But you know, the first Public Health Act allowed water to come in. It allowed the great sewages, etc. Actually, sanitation is quite important, certainly in developing countries. But they did more than that. So this is the centre of Wolverhampton, and this is West Park. And this green lung was very important because they recognised this importance of of well-being, that you can't just work, work, work. You have to have spaces, this green lung. And actually, whilst the Victorians did it, and there are good examples in Birmingham, use Wolverhampton on this occasion, it's a reminder about people and what people need. So going forward 200 years from the great social reformers, and of course they did it because their workforce would die early. So the great Victorian social reformers, it was enlightened self-interest. If we had to raise an army today, we couldn't. Because people are actually, the kids, the young people, we don't have enough fit young people. We could not raise an army today, very similar to Lloyd George after the Boer War. We could not do that. And that's a stark reminder. Now, we may not need an army with drones, etc. So I'm sorry if I drone on. But actually, that's where we are. And actually, it's a different hygiene now. Air hygiene, I mentioned that already. There's some evidence in the cities, we're getting some evidence now, poorer mental well-being, stress, anxiety, depression is probably greater. But it's also about positive well-being. And I'm very much taken with these 5 steps, which the New Economics Foundation are talking about, which is about being active, observing, learning, giving, connecting. It's about building resilience and assets. It's not about you've got a problem. It's actually how do we help you achieve your potential. And I think that's what public health is about. And I think that's what urbanism is about. How do we help people achieve their potential? And it's really interesting, if you use just those 5 headings there, do we actually do that in our design? So there's a view north, I think, view north of the 7th floor of the library. The tower helps us connect because that's the old BT tower. And I took that to remind us that talking to one another is really important. How you do that, a variety of means, but it's really, really important. So I'm suggesting a new question. Actually, shouldn't we be saying, are cities making us happier? Are cities making us live longer? And if we don't actually answer that, then I think there's a problem. Because our buildings, our environment should be for our people. That's their purpose. And I think we'd all agree, wouldn't we, that being happy and hopefully living longer is something that we'd all want. I think. Although I think my mother-in-law likes being grumpy. And she keeps saying that she wishes she wasn't around. But I'm not too certain that everyone thinks that. And certainly as I approach that last box on the insurance form, I kind of feel I want to live longer and be happier. So I kind of feel that's probably where most of us are. So why shouldn't we design well-being into our cities, into our buildings? Really interesting. In the building I work, most people got signing on cards. The signing on box is right next to the lift. So what do people do? They've taken the stairs out of New Street Station. Simple calculation would show that will mean that we will increase by 20 tons the amount of fat that goes on people in 1 year. 20 tons of fat just by putting escalators in there per year. So over 30 years, that's quite a few buses, trainloads of people. And we've done that. We've allowed that to happen. So what would it look like? Well, New York are playing around, well, not playing around, they're trying things. We've seen a picture of Amsterdam. I think, actually, if you start off with that question, you may come up with different answers. I'm sure as damn it doesn't mean having the clocking on card next to the lift. I'm sure as damn it doesn't mean going underneath cars. Actually, who's more important, a car or a person? We can debate that. Others have tried it. But I think if we're driven by being as happy as possible, sure they're trade-offs, I'm not stupid, and living longer, it puts a different dimension. Also, I think it's really important, Amsterdam is a good example of opportunity and role modelling. The more people cycle, the more people cycle. Bristol is on that cusp of people cycling. But you've got to give that opportunity and get people on there. And once they're on there, and more people go on there. Fit bands. I don't know whether you know about fit bands. I've been around for some time, actually. But you get to that point where everyone does it. And that's exactly the same. But they won't do it if they don't have the opportunity. And actually, it's up to us to build that opportunity in and actually role model. Role modeling is really, really important. What your parents did, you probably do. So, if I give an example, if your parents smoke, there's about two to three times increased chance of you smoking. But actually, if your friends smoke, there's 20 times chance of you smoking. So if your friends cycle, you'll cycle. If your friends get dropped off at school because they can, you'll say to your dad, your mum, drop me off please. Otherwise I'll look, as somebody said yesterday, I'll look like a tramp if I'm walking to school. How is it? We've got to a phase where walking to school, you are a tramp. I'm sorry. Perhaps I've missed an episode of EastEnders or something, but that's kind of... Anyway, I hope I've been contentious enough. I hope it's about happiness. And we should actually be saying, how do we make people happier through designing our city? I think that was what I think that's kind of where I am really. Yes, cities intensify inequality. Our job is actually to mitigate that. We'll never get rid of inequality. It's been there for years, thousands of years. But we can actually reduce it. There are things that we can do. So, people come to cities already have risks of dying early. My dad, for example. But people living in cities are impacted by the design and the function. And we should be purposefully, not by chance. It shouldn't be by chance. We should be aiming to improve well-being because it's us. It's us. If it's not me directly, I may know somebody, or it's my family, or it's somebody within 6 contacts, if you believe that theory, of 7 or whatever contacts to know everybody in the world. We know them. And if it's all dreadful, what do I think about? Well, I think about this. This is a kind of my relief. And it's not a city, but it's just what do I think about? And actually, there is that issue about I can think about this, but what about the other 1.1 million people in Birmingham? Especially those without a job. What do they think about? And how do they relax and improve their well-being?